Which of the following patients is most at risk for the development of a hiatal hernia? A. An 80-year-old obese male who loads trucks for work. B. A 35-year-old pregnant woman with a gastrointestinal tumor. C. An obese male who smokes cigarettes. D. An 80-year-old obese woman with alcohol-related ascites. E. A 30-year-old male professional athlete. The answer is D. An 80-year-old obese woman with alcohol-related ascites. Advanced age, female sex, obesity, alcohol abuse, frequent heavy lifting, pregnancy, gastrointestinal tumors, and smoking may increase an individual's risk for the development of a hiatal hernia. The correct scenario represents 4 risk factors. The nurse cares for a patient with appendicitis. Which of the following positions is best for improving breathing and relieving abdominal pain? A. Trendelenburg. B. Reverse Trendelenburg. C. Fowler's. D. Side lying. E. Sims. The answer is C. Fowler's. Fowler's position, head of bed, HOB, elevated 45 degrees, increases comfort, ventilation, circulation, and relieves pressure from the thorax. It would be best for this patient due to the pain experienced by the patient in the abdomen. Sims position, halfway between lateral and prone, upper arm flex, lower arm behind patient, is used when a patient is receiving an enema or an examination in the perineal area. Trendelenburg, HOB lowered, feet elevated, is used for patients with hypotension, as it promotes venous return. Reverse Trendelenburg, HOB elevated, feet lowered, is used to promote gastrointestinal problems by minimizing esophageal reflux. Side lying, patient on side with top leg in front of bottom leg and hip, knee flexed, is used to relieve pressure from the sacrum and is often rotated with patients who are on bed rest. A 35-year-old client is being discharged post-hemorrhoidectomy surgery. The nurse is explaining in detail all discharge instructions to be followed for a successful post-operative period. The client will need to adhere to which of the following instructions? A. Avoid pain medications post-procedure as they may cause constipation. B. Avoid bowel movements until sutures are removed. C. Use of daily enemas to promote frequent bowel movements. D. Take oral pain relievers prior to bowel movement to reduce discomfort. E. Use of rectal suppositories in place of oral stool softeners. The answer is D. Take oral pain relievers prior to bowel movement to reduce discomfort. To prevent pain during a bowel movement post-operatively, pain medication is often indicated to help make it more tolerable. Pain medications will need to be given post-op and may contribute to constipation, but oral stool softeners and a high-fiber diet can help to avoid the constipation. Rectal suppositories and daily enemas are not needed. Bowel movements should not be delayed nor avoided in the post-operative period. A client is being treated on the medical surgical unit for pneumonia and has recently developed severe diarrhea. Upon cultures performed, it has been determined the client is now carrying Clostridium difficile, C. diff, and will need to be on special precautions to prevent the spread of this disease. All of the following are consistent with the appropriate precautions when dealing with those infected with C. difficile except A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. B. Healthcare providers, as well as visitors, will put on gloves and wear a gown over their clothes while interacting with clients with C. difficile. C. Hospital rooms and medical equipment that have been used for clients with C. Difficile must be disinfected and cleaned thoroughly. D. When possible, client will occupy a private room or share a room with another C. Difficile client. E. All healthcare persons interacting with the client will wash their hands with soap and water or alcohol rub prior to contact. The answer is A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. This client is to be aware on contact precautions. The wearing of a mask is consistent with airborne precautions, which is not necessary for C. diff. All other choices are appropriate for contact precautions. Overdose of which of the following over-the-counter medications is one of the leading causes of liver failure in the United States? A. Diphenhydramine. B. Acetaminophen. C. Loratadine. D. Cimetidine. The answer is B. Acetaminophen. Acetaminophen causes more liver failure in the United States than viral hepatitis, making it one of the most common causes of liver-related emergency room visits. It causes approximately 78,000 emergency room visits and 150 deaths due to liver failure each year. None of the other medications listed are associated with liver failure.